welcome to Leading Entrepreneurs of the World. My name is Glenn Turansky, and I am a member of the advisory board here at One Business World, the host of Leading Entrepreneurs of the World. Leading Entrepreneurs of the World features entrepreneurs, founders, business leaders presenting on cutting-edge topics and the latest in industry developments. Our goal is to provide the global business and entrepreneurial communities with a window into the minds of those who are shaping the future of the world. Today, we're very happy to welcome leading global health technology executive, educator, and thought leader, Anil Thapliyal. Anil is the CEO of Health TRX and is also the executive director of eMental Health International Collaborative. Anil is well known for pioneering the design, development, and implementation of well-known eMental health initiatives around the globe. His reputation is built on groundbreaking work for New Zealand, Canada, the United States, and Australia in the areas of strategy, policy, and implementation of scalable eMental health solutions, such as the National Depression Initiative in New Zealand. He has repeatedly demonstrated his leadership in both primary and secondary care in developing integrated systems across the care continuum, ranging from promotion, prevention, treatment interventions to social support. After having co-designed several digital mental health initiatives with mental health service users, he is guided by his firm conviction that we must focus on the service user, their families, and carers. If it does not work for them, it does not work. In recognition of his expertise in the eMental health domain, he was appointed as an adjunct professor at the Faculty of Health and Environmental Sciences, Auckland University of Technology, New Zealand, in 2014. Then, in 2018, received the Commemorative Award for his services to the eMental health domain. At Auckland University of Technology, he led the establishment of an annual invitation-only think tank on eMental health, which has become the leading international expert forum focusing on implementation science. Anil has become a sought-after speaker, both nationally and internationally, particularly on the topic of seamless integration of digital technologies and improving access to mental health. He's the proud father of 3 grown-up boys and is an avid scuba diver. Of course, because you're in New Zealand, right? You have to be a good scuba diver at that point. We are very pleased to have you, Anil. Welcome. We look forward to your presentation today on eMental health. Let me hand it off to you, and I'll be back with you on the backside of the conversation. Okay. Thank you and welcome.
Well, thank you so much for this introduction, Glenn. So I'm really pleased to have been invited and to present and share some of the work which we have been doing around the world. So yes, I'm really pleased to be speaking to you about digitization of the mental health ecosystem. Now, we all know what COVID has thrown at us in the last 18 months. It has been quite a journey, regardless of which part of the world we live in. It's been a journey for us, either at a national level, at a community level, or at individual level. The restrictions around travel, moving around, whether you believe in vaccination or not vaccination, children's schooling and universities being disrupted. And so a lot of challenges at regardless of what age bracket you are in. So in terms of what does eMental health mean, I think it's a global conversation because I lead this organization, eMental Health International Collaborative, which is the world's peak body in eMental health, looking at the implementation. But it can be quite a challenge when you lead a global peak body in an area which can have various naming conventions around the world. So in some parts of the world, mainly the Commonwealth countries such as United Kingdom, Canada, Australia, New Zealand, it's quite acceptable term to hear about at a policy circles level, eMental health or eMental health and addictions. In the United States, it's very common to hear about digital therapeutics. And other countries, you hear about e-therapy, some countries, blue prescription, digital mental health, online mental health, internet-based interventions, online self-help and self-management. So it can be quite a bit of a navigation journey for the non-initiated, but at a macro level, all of these things are pointing at the e-mental health or digital therapeutics in US context. I think it's also important for us to know what it is and what is the accepted definition around the world that underpins the e-mental health domain development. So the most accepted, the definition is looking at the mental health services and information delivered or enhanced through the internet and related technologies. This is a piece of work which was undertaken by Helen Christensen at Black Dog Institute. She's based out of Sydney in Australia and widely regarded around the world as the definition that underpins e-mental health. So there are 4 components, and it's important for us to understand what those 4 components are before we even talk about what those e-mental health products and services are and what digitization in each one of those contexts means. So first and foremost is an information provision around wellness, around the mental health, around addiction. And so it is not necessarily just for me as an individual, for myself. It could be something I'm concerned about my partner, maybe my child, or maybe my family member who's not living with me. It could be a parent of mine who's living in a retirement village facility. So I'm worried about, so it could be for the other person and I do not know what to do. And so I'm seeking information. So at the moment, if majority of us Google something, you receive range of information, and we know a majority of the information, while it's written up by good Samaritans and good people, well-meaning people, but it's not necessarily entirely true and accurate at most of the times. Information provision is a huge industry, and it is part of the e-mental health domain. So there are big companies like Health Navigator, whose sole role to exist within the health ecosystem is to provide the accurate information so people can go, and particularly if you're a prescriber like a doctor or a physician or a psychiatrist or any sort of mental health care worker, then you can go to some reliable source of information which you can give to the people who need that information. Second one is also looking at the engagement. So in majority of the cases, regardless of which country you are in, there is a wait list is quite long as to access mental health services. In UK, at eMental Health Congress only 10 days ago, a figure was presented. A wait list is 3 years. So if I'm a 6-year-old kid, by the time I get seen by a provider of the service, I will be 9 years of age. And if I'm in a critical mental health or dire straits, so it's unacceptable. In Canada, that wait list is, depending on which province in Canada you live in, it is can be up to 9 months or 6 months at the latest. United States is no better. Australia is no better. New Zealand is no better. It's just months vary, weeks vary, but it's totally unacceptable when you are in the deep, dark space that you have to wait that long. So engagement is in between the sessions or pre even you seeing somebody, that what does engagement look like, giving the people who are wanting to access services no option, no engagement is not acceptable. And then even if I see somebody today and I get to see the same person, say in another 2 weeks' time, 2 weeks is a long time for me to be on my own and not feel if I'm doing it all right and how things are, how my coping mechanisms are working for me. So engagement tools, they are digital tools. So sometimes we call them patient engagement tools. There's definition in the digital mental health world, e-mental health world, called PROM and PREM, which is called patient-reported experience measures, patient-reported outcome measures. They are part and parcel of the engagement tools. Then the third cohort is looking at the interventions, e-mental health interventions. So when we talk about mental health is not one, it can be a fairly loaded word when you talk about mental health. But mental health generally widely internationally is regarded as something which is a patient doing a journey. So from wellness, unable to cope with some life stressors around, looking at the mild end of the challenges, then looking at the moderate end of the challenges, which could generally be fitting into what we call as a primary care, where you go and talk to your GP. In some cases, some people require hospitalization. So we are talking about the hospital services at that point of time. So we are talking about the acute end of the cases. So depending on the step care continuum where you are, so you require varying degrees of interventions. And e-mental health solutions or digital therapeutic solutions are no different. Not every solution is going to be fit for purpose at every level of care point. So if it is a mild, it is a moderate, or acute end, there are different e-mental health solutions for mild, moderate, and acute end of the solution. So the mental health, when I refer to it as e-mental health, I'm also referring to addiction as well. So that is drug and alcohol treatment interventions. I'm just so delighted some of the work in the United States led by Dr. Dave Gustafson out of Wisconsin University, and some of the great work by Peer Therapeutics. It's amazing institutions which are doing world's leading work in the relapse prevention work in alcohol and drug that field fits under the e-mental health addiction domain. Some of this work, not some of this, all of this work is also FDA approved. So these are not just a fringe innovation, they are happening and they are being used and prescribed by the physicians as required, and also benefiting a lot of people, not just in the United States, but just around the world. But also the fourth component of this e-mental health is looking at the social support elements. And the social support elements is looking at, we know if I am presenting at the emergency department with some self-harm incident where I may have, tried to, injure myself. At that point in time, we know the people who receive some sort of level of support, digital support, their hospitalization can be delayed by a significant amount of time, rehospitalization I'm talking about. So we know the ongoing social support matters a lot in the patient's well-being journey and their recovery. So social support, what does it look like, how that can be provided post-discharge from the care settings. So that is looking at the e-mental health from a definition point of view. So, but also looking at the e-mental health as does it mean that we do not need a psychologist? Does it mean we do not need a psychiatrist anymore? That is not the case. It is not a replacement of traditional mental health services. And majority of the cases around the world at the moment, it is seen as a complementary adjunct. It is a blended care type system where the self-help, self-management tools, PREM tools are integrated in the way the care services are delivered to the end user. Also, what is very important to know at this point of time is why e-mental health or why digital therapeutics at this point of time. Some of us may have heard of it. I have, because I live and breathe this all the time. But for the average person out there, it could be quite a challenging. What does it even mean? What does it look like? So I want to refer to a survey conducted in UK in 2017, which looks at how people are communicating, each one of us, regardless of, adults. So this is respondents are 18 plus years of age. So the number one utilization of this device, which each one of us have, is a smartphone. I think most of us carry around, regardless of which country we live in. So 88% of the people, the respondents, use texting as the number one mode of communication. Number two is email. Number three is Facebook. Number four is camera. Number five is reading news. Number six is shopping online. Number seven is checking the weather. Number eight is WhatsApp. Number nine is banking. And number 10 is YouTube. And surprise, surprise, making a phone call from this phone did not make it to the top 10 activities. So basically, the analogy I like to use based on this data set is, it is how we are communicating in this day and age. So while talking about making phone call may be is the first thing that comes to our mind, but the way our behavior is, it is not even the top 10 activity from our smartphone. So there is a service in the United States called Crisis Text Line, which is the world's biggest and most heavily utilized service. And it is incredible amount of work they're doing. Their entire engagement in mental health and addiction throughout the United States is just using text messages. And it is, they've established the world's best practice in this area. So it is happening, and because the reason why Crisis Text Line is so successful, because they are speaking the consumer's language, because that is the number one way people are engaging with each other. And also there is a journal for the medical association, which is JAMA, which is looking at the assessment of the data sharing privacy practices of smartphone apps for depression and smoking cessation. This study is across United States and Australia put together, and that looked at the 36 top ranked apps that were being prescribed by the physicians, and 29 of those eMental health solutions were sharing the patient's data with the third parties. So not all things that are eMental health, which are available, are safe and effective. Just to give you another data set, there are, at the moment, around the world, 325,000 to 400,000 e-health interventions. So that means you can have a variety of digital interventions available if in e-health environment. Out of those, around 47,000 of those are for mental health. And only 32% of those e-mental health solutions are safe and effective for people. So that means there is a whole lot of more than 60% of those are causing harm for the people who are using them, because there is no efficacy behind them, there is no randomized control trials behind them, there is no what we call evidence-informed approaches that have been woven into those solutions. So not everything that is e-mental health is safe and effective. And that could be quite a big challenge for the systems of care like SAMHSA, which is United States peak body for substance abuse and mental health. And so how do you create guidance so that making sure the people across the United States or in any other country, the systems and the e-mental solutions services they are using are safe and effective. I use this analogy: would you buy a car without a warrant of fitness for yourself or your children? Answer, I think we all know what that would be. So I think how do we look at e-mental health is no more just a fringe innovation out there, but how do we look at that as an integral part of the mental health care? It is part and parcel of the mental health care. A lot of the systems of care haven't moved on because the traditional procurement processes mean that the procurement of those services is still happening in the way it used to happen in 50 years ago, or 70 years ago, or 20 years ago. So that means some of those services are very staid and very so not fit for purpose or fit for the time. And we know that poor mental health creates economic drag for the nations, So what does development of sustainable and scalable e-mental health services, which are woven very effectively into your practice, what does it look like? It is plausible, it is possible. Many countries have got it right, or many regions within so many countries have got it right because they've got it right by design, not by default. So there are 5 components to getting it right. So one of that is majority of the time we innovators like myself and many of you who are listening to this presentation, we get excited about technology. We think, oh my God, I can solve this problem. And but the reality is, majority of the time, what we find is that conversation is devoid of aligning itself with what the systems, policy, strategy, and standards of policy level. So that means SAMS, Health and Human Services, the Ministry of Health level, and various other countries. What is the innovation drivers, is the development of the digitization in mental health, is aligned with the pain points, whatever those pain points are. So look, for example, and majority of the countries we know, one of the biggest, we know that anything up to 70% of the completed suicide are men. So there is a huge driver for a lot of nations out there. I know that in New Zealand, the numbers could be anything up to 76% of the completed suicide being men. So one of the key policy driver is how do we reach out to more men? So e-mental health solutions, if they can help find some of those policy pain points. So looking at policy also has so many naming conventions. So some countries, we talk about policy and strategy. New Zealand has got an e-mental health assessment framework, and Australia has also got, they got an e-mental standards. There are notions of equity, because we have many nations, like in the United States, we talk about general population, but we also talk about the First Nations people. In Australia, we talk about Aboriginal people. In Canada, we talk about First Nations people, whether it be people living in far north. In New Zealand, we talk about the Maori people. So how do we make sure that e-mental solutions are fit for purpose for the entire population rather than for a segment of the population? So what are the population health approaches look like? And is the procurement of these solutions fit for purpose as well? Because sometimes innovation can happen, but the procurement hasn't kept up with the times. So that means we are still procuring things which are very traditional and rudimentary and not fit for purpose for present day and time. Particularly, we know what COVID has thrown challenges at us. Another one example would be is looking at big parts of the United States, Canada, Australia, the remote and rural nature of the organizations or the landscape. So you can't open a clinic for every 200 and 300 people of small communities up the coast of, say, Bering Sea and state of Alaska. So I think we need to find smart, innovative solutions which provide the solutions at the point of time wherever the people are. Another one is looking at the providing solutions is one thing. The second thing is, who says it works? I shared some of the data earlier on, around only 32% of the total available solutions out there right now are safe and effective. So who says it works? Evidence, are they evidence-based? evidence informed, because the development is sometimes so rapid. So how we can't afford sometimes 3-year long randomized controlled trials. So what are other modalities that are developing, which are key, ensuring that these programs are safe and effective? Ethics and law considerations, confidentiality, and so many aspects around quality assurance, around accreditation and activation. So how do we ensure that we take the whole aspect of implementation right, but also evidence underpinning all those core components? As in my introduction, it was said that if it doesn't work, for the people with lived experience, so for the end users who are using these services, their families or the carers, then these eMental services solutions don't work at all. So the reason it is important to have the lived experience, the people with mental health lived experience, part of the core design while we're developing evolving these services as a genuine co-design, as opposed to tokenism, which is bringing some people and saying, running something past them and saying, yes, we have consulted the lived experience of consumers of the mental health system. So I think there is sometimes a non-participation, sometimes a tokenism, but I think looking at planning jointly, honestly, and delegating responsibility and making them part of not only the design development, but also the implementation. I speak at a lot of Congress conferences around the world every year. And majority of the times I'm surprised because the rooms are packed, the people who come to listen to what I have to say about digitization of mental health. But I'm always often surprised as to, while people are interested, people are not knowing what it means for them in the practice they are involved in. So if I'm a GP, as a primary care physician, I don't know, I like what you're saying. I do not know how could I embrace it in my practice. So I may be using an EMR system or patient management system, or which part of the patient management system or EMR system I go to look at what eMental health and addiction services are available, and am I able to, from within the palette of the EMR system, am I able to prescribe these self-management tool, eMental health solutions to the patient who is sitting in front of me, or maybe I'm doing a teleconsult, so I'm able to email it to them or prescribe it to them. And I'm just giving you one example, and the same logic applies for if I'm working in a hospital care system or in a community care system. So a workforce is spanned across from general health advice to promotion, prevention, early brief intervention, primary care, secondary care. And it is not just the regulated workforce, but we are also talking about the unregulated workforce. So we're talking about workforce development is central to getting it right. Otherwise, what we'll have is we would have made a lot of investment in majority of the times, but not necessarily seeing uptake either by the physicians or their inability to prescribe these tools and services at the right point of time and care so that it is effective. Because if you provide it out of, make this referral out of context, then it's not going to work. So, so where does the patient journey is, and at the right point of interjection that a prescription needs to be generated or a referral needs to be generated. Fifth element, which is one of my favorite, is I see health IT industry having a massive role. So it's whether we have a Kaiser Permanente, whether we have Cerner, whether we have MedTech, there are so many amazing systems which are providing infrastructure for the way we manage our systems of care around the world. So regardless of who those providers are in different countries, so there are, so e-mental health is not something which is sitting devoid or outside of those systems. How do we, so I see all those providers of IT infrastructure, whether it be data aggregation agencies, and so we're talking about a eMental health solution provided by an organization in New Zealand called Whakarongo Rao. It's a $400 million a year organization. How sophisticated they are and how they have partnered with New Zealand's largest telecommunications provider, which is called Spark. So how do they work with them? So I think working in isolation in silos is no more fit for purpose for 2021 and beyond. Compliance to requirements, whether it be HIPAA, whether it be GDPR, CQC, Data Protection Act. We are talking about, and it's evolving at such a rapid pace. How do we even, anyone keeps up with the compliance requirements? Well, what does, when I talked about information provision, so when we're talking about anti-stigma campaigns, or so whenever we are talking about a massive programs of work which are targeted at a population health level, either at a county level, at a state level, or at a national level. So I've had the fortune of having worked with some of the world's brightest in the area of communication, whether it be Colenso BBDO, Draft SCB, Saatchi and Saatchi, where we are looking at taking the clinical message around the mental health. It could be depression, anxiety, social anxiety. It could be around alcohol, drugs, gambling, domestic violence. Any one of these messages, how do you then look at that message, and how do you create a message which is easily consumed by the population of that nation or the region? So reading age of certain countries could be 11 years of age, in some countries 14 years of age. So when we look at these so-called safe and effective interventions, clinical messages, and it's quite beautiful to see what comes back, and that how that gets communicated through various channels such as television, social media, to the populations of those nations. So it's been a joy to see, look at what is the role of the creative agencies, but looking at also the content generation, because that is the actual substance. So who are the people doing the content generation? So health IT industry is quite a sort of a big industry. It has got a lot of amazing solutions, whether it be in New Zealand, Canada, Australia, United States. There are amazing solutions that are working. But the key thing which I wanted to say is optimal activation or optimal implementation of digitization of mental health is about not just about getting one thing right. It is about making sure the policy and strategy has been factored into it. Otherwise, you could be making a huge investment into developing something which is never going to be scaled to a level where it's going to have a national or international impact. So looking at the understanding the policy and strategy context of the nations wherever we are working, looking at is if it's evidence-based or evidence-informed. Lived experience I talked about, so that working in conjunction with all of that, workforce development I talked about, and health IT industry. I like to use the analogy here is, if I am a great piano player and that's my core expertise, there's no point in me trying to learn how to play good violin at this stage in my life. I probably can learn violin. The reality is, if I can let each maestro play their own instrument, that is the only way to create symphony. Otherwise, it will never work. It will be not scalable, and it will not be sustainable long-term into future. So that's what the optimal activation is about, getting those 5 elements fully aligned and working in synchronous way with each other. So that policy, evidence-based, lived experience, workforce, and health IT industry. So there are the kind of organization which I lead, which have been introduced in the context of eMental Health International Collaborative. I think I would highly encourage you to go and have a look at what we do around the world, not just in one country. But at the moment, my governance board is made up of representatives, senior government representatives from Sweden, UK, Australia, and New Zealand. Australian representative is the CEO of the National Mental Health Commission of Australia. She's also the advisor. Christine Morgan is also the advisor to the Prime Minister of Australia on suicide. United States is just coming on board, so it'll end up being 5 countries on the board. But we do have an amazing array of Global Leadership Council, which is some of the finest thought leaders. I'm talking about the finest of the finest thought leaders on the Global Leadership Council. So we have Sweden, Norway, UK, United States, Canada, Australia, New Zealand, Singapore, Asia Pacific Economic Cooperation, 23 countries in Asia Pacific region, World Economic Forum, and academia, and recently World Health Organization as well. So we got a range of entities which are on the Global Leadership Council. And one of the interesting ones which I would like to note here is Professor Jay Bucky from Dartmouth Medical School, an amazing academic, also happens to be a gentleman who's an astronaut working on applications with NASA, which is with the National Space Biomedical Research Institute, NSPRI-funded research grant on looking at developing eMental health solutions for astronauts who are going to travel into space for more than 6-week duration of flight. So the privilege to just be associated with the thought leadership at that level who are thinking about what are we going to need into the future. So eMental health is no more a fringe innovation, sort of something which happens. This is a huge investment that is going into it. And we have investment also needs to be aligned to making sure that we are factored in all those aspects of that keep this domain safe and effective for the people who are investing such a huge amount of fiscal resources. So there are special interest groups on ethics and law, strategy, policy and standards, phone and text helplines. I talked about the crisis text line in the United States. It's already one of the world's best practice. So how do we learn from each other? What does a lived experience participation look like? Accreditation and activation, evidence creation, corrections. I just am, appalled to see how most of the corrections of prison systems around the world, including in the United States and Canada and Australia, New Zealand, people were so ill prepared around the pandemic, COVID pandemic times, to be able to provide mental health services to the prison populations, workforce, indigenous communities, AI in mental health, high performance sports. We already know that more than 3/4 of the people post leaving the high performance sport, whether it be US Olympic team or whatever. So we know that the impact of mental health issues is more than 3/4 of the people have need some sort of support, and that support. So there are some specialized interest groups focusing just in these areas and the role of the industry. So we have some amazing things around how do we work with each other. So this is not just should not be the purview of some privileged few who happen to know somebody. I think mental health in particular is a grief of a mother, whether she's living out there in the remote part of Texas, or whether it be a remote part of far north of Alaska, whether it be in the urban New York, or whether it be in central of Australia. I think grief of a mother is same who loses a child. So how do we make sure that we learn from what has worked and what still needs to be? So we have sessions called brag and steal. That means each nations can brag on about the best practice, and other nations can steal the ideas. So it's something which has worked very effectively. So we collaborate across the borders, and a trusted network of subject matter experts in those 5 core segment areas which I was referring to earlier on. These are some of the things which we 10 days ago we talked about is the eMental Health Congress, which we just concluded. There was New Zealand Ministry of Health launched eMental Health Assessment Framework. Now, it already exists for New Zealand Ministry of Health. Ministry of Health in New Zealand is more than happy for anyone, doesn't matter which part of the world they are in, to look at it and replicate it for themselves. So I think the key thing is, how do we learn from each other? What is the position statement on ethics and law for eMental look like? That was also released at the Congress. So I think there are so many things as to the Lifetime Achievement Award and the US award winner this year. I was just so delighted. Corey McCann, the CEO of EHealth Therapeutics from the United States, won the US National Supreme Award in eMental Health. So I think there is a lot of great work happening, but a lot of great investment happening. My biggest litmus test is what's happening in Silicon Valley. We are seeing the investment in eMental health now running into billions of dollars and multiplying every year into seriously big dollars. We know the Headspace acquiring Ginger IO and Ginger IO inquiring iHope Network. We know acquisitions are happening. It's very exciting times we are living through right now. And so it is, eMental Health is a conduit for positive change. And COVID has pushed us over the digital divide by necessity. But I think it's also onus is on us to how can we reach people sooner at a time and place of their choosing. And we can also, just cause we can talk about sometimes mental health in isolation, but sometimes I may be having other chronic health condition, quite physical disability or other challenges around healthcare needs. So mental health can be a comorbid situation for me. So how do we provide a unique blend of services which are appropriate for that person rather than dealing with a part of that person? We need to treat the whole person as a whole. I talked about wait list earlier on. I think it's totally unacceptable for anyone to be waiting for such a long time, regardless of which country we live in. I think we have a responsibility in this day and age when there's so much innovation happening digitally, and we are still lagging behind. It's a shame that system hasn't kept up, and that we haven't pivoted in the way we provide services to align with people's needs. We already know there are 5 million downloads a day of eHealth apps a day. This is not per month, this is every single day. So this ain't gonna go anywhere, whether we like it or not, whether we embrace it or not, whether we provide safe and effective services or not. People are Googling and downloading 5 million eHealth apps a day. How do we ensure for things of such magnitude that we provide, how do we ensure that we provide appropriate infrastructure that is in place? How do we coordinate with each other? You know, sometimes it looks like one system of the healthcare does not talk to the other systems of healthcare. Are we almost, we're talking about, we compartmentalize the human being into different portions. So we need to coordinate across systems of care much better. We look at, can we create a standardized approach? COVID also made us focus on what are the well-being solutions, and how where there some countries coined a term called psychosocial well-being. So yes, we have, regardless, depending on which country we live in, there are various terminologies we become accustomed to, and but by the end of the day, how do we keep our population safe and effective, and how can they benefit from these eMental solutions? We need to also drive to achieve equity. Not everyone has same benefits who's living in a center of, say, New York City, so access to good Wi-Fi and other things, and data sort of plans they have. Some parts of the United States, somewhere in Tennessee or some other place, New Mexico, some parts, how do we make sure that equity is there, and when we design, develop, and implement these solutions? So I talked about the policy perspective, but one of the things is, from a policy perspective, is also one of the Canadian example was around setting small and achievable goals, because the reality is, it's good to go big bang, but the reality is also it's so much driven by what has worked in other jurisdictions. So relationship building, the trust, so that those sort of, how do I learn? I shouldn't be making mistake and experimenting with people's lives who are accessing those services. So what does a true meaningful engagement looks like? What is a community-based call to action? So we need to just make sure that we set strong roots for whatever we touch. So with that, I would like to bring my conversation to presentation to a close. And it's been a pleasure talking to you, and I hope the information I've shared has been of some use to the listeners. So thank you so much.
Thank you, Anil. A lot to unpack. A lot to unpack. I was going to ask you, and you mentioned earlier in your remarks, and then you kind of tied it back in at the end. I was going to ask you, how do you overcome, or how do you compensate for the digital divide that might exist? You mentioned remote locations, or even rural locations, and even in well-established, infrastructure or countries like the United States, there's still digital divides. How about when you look across the globe and you start trying to think about that type of situation? Any thoughts on that?
I think some of the most successful initiatives, Glenn, that I've been fortunate to have been involved with. One of them was with the Minister of Health in one of the provinces in Canada called Newfoundland and Labrador, easternmost province of Canada. Yep. The Minister of Health, the Honorary Jerome Kennedy, said to me, the Newfoundland and Labrador is such a huge province and goes all the way up to the Arctic region to the top. And they got smaller population on both sides of the coast. Some of the villages are only 200, 300 people. And he said, the oil has dried up, cod fishing has dried up, there's a ban on cod fishing. So, and there are challenges, while the province is rich in many other ways, but there are a lot of mental health challenges like any other part of the world. But the minister's vision was, in this day and age, we have to find smarter solutions. Online solutions, offline solutions. We need to do something. We cannot afford to just wait for the perfect thing to arrive at us. We need to front foot it, and doing nothing is not an option. So what I've taken is sometimes some of the most successful initiatives, Glenn, I've seen are based around leadership. Somebody has got a strong vision, and they have a sense of urgency, and they have a strong appetite to take risk. Because he didn't want to see which other country has got it right, then I will do it. He actually became the best practice exemplar for the world.
It takes courage to step out.
Offline solutions. Yeah,
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 courage to step out. It's interesting because it can be a blend, right? It can be a little bit old fashioned,
absolutely.
but also high
Yeah,
tech at the same time. So in a way, it's when I was at I was at the New York Stock Exchange for a long time as part of my career, and one of the catchphrases we used to say was high tech, high touch. And
yeah.
it's kind of a similar type of basis. You hinted upon, and I was going to ask you this too. When you look at mental health, just as a topic or a subject, how much how much does the social determinants of health play into that? When you think about education challenges, poverty, and the like, socioeconomic kind of conditions. If you improve that, work on improving that, can you make strides in the mental health arena?
Absolutely. I think, to be honest, like we can talk about being ambulance at the bottom of the cliff, or do you want to put a fence at the top of the cliff in the first place? So, so promotion prevention initiatives are not to be underestimated in the mental health space. There's a huge need to destigmatize it and access help early. So sometimes, as a male who cannot comprehend middle-aged, reasonably successful, say if I've got a rugby player background and a male macho living and I own say 10 guns and I like going hunting on my holiday, and all of a sudden I come back from a holiday that I've been made redundant. And I just bought this property and I then realized my wife has taken off with my kids. And I don't see that as mental health. I think I can't cope with this life. Our coping mechanisms have been exhausted. So I can take some extreme step, find a piece of rope or something, and cause myself some grievous self-harm, which can result in the loss of my life. So because I've not been unable to relate those events with mental health. So sometimes mental health is a terminology for the people who are providing those services. The person who's going through life experiences, those are stress points where my coping mechanisms have just gone beyond a saturation, a threshold point where I just, so had I known that I could access some support services, probably I was more likely to access those support services. So we have amazing initiatives around the world, fronted by some local legends who are the football players or whatever, but they're not the people who are the actors, but they have also been through it themselves. People resonate with the authentic message these days. People have seen enough of, I also talk about in e-mental health world, there's too much information out there. Info obesity, there's too much information. How do I consume? Which information do I believe in? So we need to simplify it, to make it something which people can consume, believe in. As a trust is a key thing here. So social determinants play a huge role. How do we provide early brief intervention at the young, when early stages of education, when people are in the early childhood education centers and other places? So I think parenting advice, there's so many things we are talking about here. Workplace well-being. So workplace is one of the biggest areas where loss of productivity. We are talking about billions and trillions of dollars, to be honest. So we are talking about this social determinants are a huge part, and that's why majority of the time the big part of. So I'll just give an example of some of the nations. So like the total sum of funding that is available, generally biggest part of that, which is close to 90% of that in most countries, goes to the traditional hospital inpatient, psychiatry, care, just a traditional thing, which has got nothing to do with e-mental health. Then there could be 7 or 8% going to the primary care, where your physician might recommend something or to give you a SSRI, a prescription. But again, there's no mental health component. And there could be 2-3% left, pocket change left to do some innovation. So system hasn't moved on. But COVID has jolted us all out of our sleep and slumber. and saying, hey, we need to rethink what the system of care needs to look like. What is a way forward needs to look like. And I think social determinants of health need to be factored in. I think we're talking about you, me, not just you and me, your family, and their, their children, and everyone, So we're talking about human beings, the real people, and even the people who are listening to us. So I think I become very not only passionate, but I just think, why such a delay? So I think when solutions are there, we are no more having to think of it like a boutique project. This is happening in various countries. And that's why I was saying, how do we learn across borders from each other as a nation, as opposed to one small company doing a small boutique project and saying, how do I capitalize on it? Which is also fine. I respect that. But the thing is, how do we create it at scale?
Well, 5 million downloads a day doesn't sound like a boutique to me, right? When you think about people accessing it. On the social marketing front, and you mentioned athletes, role models, stigmatization in this field is always such a challenge. Do you think digitalization, or again, eMental health, helps lessen the stigma because there's a certain anonymity through electronic communication, as opposed to, well, I went to the clinic and I'm sitting in the waiting room with all these other people, and who's going to see me? How do you think that may play out? Do you think it helps lessen the stigma by having the digitalization available?
I would say the broad answer is yes, Glenn. And the reason I say that is at the Congress about 10 days ago, one of our keynote speaker was Alex Dalton from Australia. He's an 18-year-old young leader speaking on mental health and transgender issues. And what an eloquent young man. I was just so proud to listen to his keynote address. But what he said is he wouldn't be, around if it wasn't for all the digital channels of support services which he was able to access in Australia. So he was referring to a range of services, which was Headspace is one, Reach Out is another one. So, but he said, while those services were just so important and so crucial to his survival, that he made it to that he is able to speak to us as a leader in the field now. But he said he did not see them as e-mental health or digital mental health. He saw them as mental health. He said, because of his age, he does not see that as e-mental health or digital mental. He said that is the way the mental health is accessed now. So it challenges the way we coin terms sometimes.
Absolutely. How about from a collaboration standpoint? Other types of social service organizations, I often think about faith-based organizations. Any chance they play a role in helping to kind of do the social marketing or on the outreach side?
Glenn, to be honest, I yet to date have to meet any person in the world, from either from your network or from my network, who doesn't want exactly what you want and what I want. People inherently are good people. They all want, benefit of the nations we live in, or the society and the communities we live in. So the challenge is, sometimes we know the problem statement, we don't know what the solution is.
Mm-hmm. Mm-hmm.
All right. So each one of us are doing what we think is right. And most of these faith-based organizations doing amazing, great work. And that is not to be underestimated in any shape and form. What I want to make sure that all of that good work is in the 32% of the work which is safe and effective.
Right.
And is not in the rest. That's all I can say. But great work happening, and that harnessing the power of the community is probably the most significant part in e-mental health right now. And one of my, we have an indigenous person in New Zealand, indigenous people in New Zealand called Maori people. and Maori elder is what we call Kuma, who's tribal chief of our organization. So he will open our meetings with prayer in Te Reo Maori language, and it's the most beautiful soul you'll ever meet, Glenn. But he talks about he tangata, he tangata, he tangata. What's the best thing in this world? It is people, it is people, it is people. And so what his message is, his congregation numbers on Sunday were going down so dramatically, people stopped coming to the marae, which is a church for Maori people, that he created a WhatsApp group. All right. And he sends out the WhatsApp group a message, tomorrow morning congregation starting at so-and-so time. And all of a sudden membership attendance went up to 95%. So he does not see that as an e-intervention. All right. So it's just a communication.
It's communicating. Yeah. It's just, that's how you do it. As you said, if the telephone is now not in the top 10 anymore, right? It's just, it's a different way of getting the message out. Hey, one last thought, and this is always the elephant in the room for any kind of health situation, I think. Any thoughts or reflections on you think about reimbursable, insurance coverage, right? Sometimes that's a stumbling block. If anything, COVID has shown, the utility of telemedicine, right, or telehealth in general. Whereas maybe 2 years ago, pre-COVID, oh no, an e-health visit, I'm not going to reimburse 100% for that. You're only going to get 25% for. And then as a provider, you're sitting here with, you're having a rather large discount for no reason. Now, any reflections on, on people recognizing the value, the ability to cut down on wait times and again, servicing people quicker and better outcomes? It would seem like they should be embracing that and not discounting it anyway, or impeding it by calling it a discount.
I probably answer this question in a slightly indirect way. And, when I liken it to, say, like your family situation, so you could probably got a few brothers, sisters, and grandparents, and lots of nieces and nephews, and most families, there are some people who hold a very sensible role to keep the family cohesive and together, and some people just can't see each other eye to eye and it is not because they are bad people. It's just that we see things differently sometimes, and as to what is right and what is wrong, and so variety of reasons. It's if that can happen in a small family, how is it going to pan out in a country as big as the United States, which has got such a huge population? So, and then payers are also so many different. So they all have insurance companies and whatnot. They have a different mindset of what a reimbursable eMental solution look like. So everyone has got a view. I don't think so there is a uniformity in acceptance. But I speak to most of the big players in the United States on a regular basis, and majority of them have got a huge contracts with now sewn up very regularly on daily basis, to be honest, and which gives me a joy and a big smile on my face. Things are turning, tide is turning, but has it turned to the level of scale? No, I think we are still in very early stages, but I'm pleased that the journey has begun.
Journey's begun, and it sounds like momentum is heading in the right direction, certainly at that point. Well, Anil, thank you for joining us today. Well, it's your tomorrow, so we really appreciate the time. Terrific, unbelievable talk, great content. Congratulations on all your success and all your good work, and we wish you nothing but good wishes here into the future. So thanks for joining us at Leading Entrepreneurs of the World. It's been a pleasure, and we're gratified for your contributions and again, continued success as you look ahead.
Thank you, Glenn.
All right, take good care. See you next time.
Thank you.
Bye.
Bye.